Okay, this is our 360. Okay. Okay. Alrighty. So I'm going to say knock, knock. Hello, my name is Adori. I'm going to be your nurse today. Okay, I'm going to wash my hands. I'm going to provide patient privacy. All right, and can I see your wristband? Go ahead and tell me your first and last name and date of birth.
Shakira Anderson, May 16, 1995.
Okay, Shakira. So before I came in, our tech did go ahead and get your vital signs. They are within normal limits. She also performed the Snail and chart test with you. She reported a 20/20, which is a perfect vision that tested your optic or your cranial nerve number 2, which is your visual acuity. So you have great eyesight. Do you have any questions about that?
No, ma'am.
Okay. So how are you feeling today?
Pretty good.
Pretty good.
Yeah.
Okay, in your day-to-day life, you feel okay?
Yeah, pretty good.
All right. And tell me, do you know where you are today?
Yes, West Coast University Memorial.
Okay. And then do you know what today's date is?
July 25th, 2026.
All right. And do we know why we're here?
Physical assessment.
Okay. And then are you in any pain today?
No, ma'am.
Okay. Pain. Okay. All right. So next we're going to go ahead and move into your physical assessment. I'm going to start off with your face and I'm just going to feel the skin is warm and dry and the color is appropriate for the patient's ethnicity. Now I'm going to go ahead and feel her hair. There's no lumps, no bumps, no bruising, no infestations, no swelling felt. Okay, and now I'm going to go ahead and move into your eyes and nose. So I'm going to shine this light in your eyes. The eyes are symmetrical and no redness is present. And then I'm going to go ahead and look into the ear canal. The ear canal in pink and cerumen is present. Pink on the other side and cerumen is present. And then I'm going to ask you to lean your head back and I'm going to look into your nose. The nostrils are pink and free of obstruction. And then open your mouth for me. The mouth is pink and moist and the teeth are intact. Okay, and now I'm going to go ahead and move into your lymph nodes. So I'm going to go preocular, postocular, occipital, retropharyngeal, submandibular, submental, anterior cervical chain, posterior cervical chain, and subclavicular. Lymph nodes are non-palpable. And then I'm going to go ahead and move into the trachea. So lean your head back. And I'm going to feel the trachea. The trachea is midline. And now I'm going to assess for your thyroid. So turn this way a little. Okay, assessing for the thyroid is palpable, no nodules felt, and go ahead and swallow for me. And thyroid moves upon swallowing. Okay, so next I'm going to be testing for a carotid brute. I'm going to check your carotid artery pulse, and then we're going to also check for JVD. So for your brute, I'll be listening with the bell side of my stethoscope. So I'll make sure that's on, and I'm going to ask you to hold your breath. And exhale. And then big breath in and hold it. And exhale. Okay. And now I'm going to feel for your carotid artery pulse. +2. And +2. And now I'm going to ask you to lean back and turn your head to a 45-degree angle. And we're going to be checking for JVD. None present on that side. And none present on this side. Okay. So now I'm going to be moving down to your thoracic cage or your upper abdomen, and I'm going to be assessing for any edema. I'm going to lift this up a little. This one too. So we will be assessing for any edema, swelling, redness, or bruising or tenderness on the upper, on the arms. There is none present for this patient. I'm going to also start with her capillary refill. I'm going to test both 2 fingers bilaterally, less than 3 seconds bilaterally, and then I'm going to go into her pulse. So we're going to check our radial pulses, which is 2+ bilaterally, and then we're going to check our brachial pulses, which are 2 plus 2 bilaterally. Okay. So now we can move into, excuse me, I'm going to check the skin turgor. Sorry. And the skin is elastic. And then we're going to move into range of motion. So I'm going to have you put your arms up and out. All right. And then down. And then we'll do it with resistance. Okay. And down. And then I'm going to ask you to flex and extend your arms. Okay. And then we'll do it with resistance. Okay. And then squeeze my fingers as hard as you can. Okay. Alrighty. Okay. I think that's everything. Yeah. Okay. So now we can move into the deep tendon reflex. And I'm going to start on this side. So just hold your arm up and let it dangle. Just relax. And we'll start with the tricep. And then relax. All right. And then we'll do the brachial. And relax. Okay. And then we'll do the brachial radialis. Okay. And then we'll do the patellar. Okay, all the deep tendon reflexes are intact. And now we can go ahead and move on to our heart sounds. So starting with our heart sounds, we're going to be using the bell or the diaphragm of our stethoscope. And we're going to listen to our aortic valve, which is going to be in the second intercostal space, right sternum border. S2 is louder. Pulmonic valve, second intercostal space, left sternum border, S2 is louder. And then we're going to move into Erb's point using the bell of our stethoscope. It's going to be the third intercostal space, left sternal border, S1 equals S2. Back to our diaphragm. And we're going to go to the fourth intercostal space, left sternal border, S1 is louder. And then we're going to go to our mitral valve, fifth intercostal space, midclavicular, S1 is louder. We're going to listen here for a minute for our apical pulse. And then I'm going to have my patient lean up. And I'm going to be testing for a carotid root. None is heard or felt. Okay. And then we're going to be moving into our lung sounds. So we're going to start anteriorly. And we're going to go 1, breathe in, out, in, out, in, out, out. And then we go here, in, okay. All right, and now we're going to be testing our lateral lung sound. So we're going to go 3 sides, 3 sounds on this side. So we're going to listen 1, breathe in, out, 2, 3. Okay, and then we're going to go to the right and listen twice for the 2 lobes. So we have 1, breathe in, and out, in. Okay, and now we're going to listen posteriorly. Okay, we're going to go in, out, 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 in, out. Okay, anterior, posterior, and lateral lung sounds are clear. And I'm going to go ahead and perform the butterfly test. You can sit. The butterfly test is just testing the expansion of your respiratory or your breathing. So I'm going to go here and breathe in and out. Okay, respiratory expansion is equal and symmetrical. So now I'm going to go back and we're going to go test your cranial nerves. So I'm going to start with cranial nerve number 1, and that's going to be testing your smell or testing your smell. So I'm going to have you close your eyes, close one nostril, and let me know what you smell.
Lavender.
Okay, and then we're going to go to the other side.
Citrus.
Okay, cranial nerve number 1 is intact. Now we're going to move to cranial nerve number 3, which is going to be your, we're going to use Perla to test that. So I'm going to shine this light in your eye. The pupils are equal, round, and reactive to light. And then follow my pen. And they also accommodate. Now we're going to be testing cranial nerves 3, 4, and 6 using the 6 cardinal fields of gaze. And we're going to go here, up, down, and here, up, down. Okay, cranial nerves 3, 4, and 6 are intact. Now we're going to move to cranial nerve number 5, which is going to be testing your TMJ and your sensory. So I'm going to ask you to open your mouth and close. And I'm going to feel open and close. No popping, clicking, or locking of the jaw. And then I'm going to ask you to close your eyes. And when you feel me touch, let me know.
Touch, touch, touch.
Okay, cranial nerve number 5, the trigeminal nerve is intact. And now we're going to move on to cranial nerve number 7, which is the facial nerve. I'm going to ask you to raise your eyebrows, puff your cheeks, and give me a smile. Cranial nerve number 7 is intact. Now we'll move to cranial nerve number 8, and that's going to be our whisper test. So I'm going to have you close one ear, and then I'm going to whisper 3 things, and you let me know what you hear.
Purple, green, orange.
Okay. And then we'll do
pineapple, strawberry, apple.
Okay. So the whisper test was completed well. And then we're also going to do the Romberg test. So I'll have you stand. Okay. And feet together, hands by your side, and close your eyes. And then here I will be testing for any swaying or imbalances. If my patient did show signs of that, we would hold it for a minute, but she does not, and that is a negative Romberg test. Okay, and now we're going to test cranial nerves 9, 10, and 12. 9, I'm going to have you, let's start with 10. 10, I'm going to have you swallow, and that's testing your vagus nerve. Cranial nerve 10 is intact. And then cranial nerve 12, let's have you stick your tongue out, and then side to side on your cheeks. Cranial nerve 12 is intact. And then cranial nerve number 9, I'm going to have you say, ah.
Ah.
And we're going to test your gag reflex. Okay. And then cranial nerves 9, 10, and 12 are intact. And now we're going to test cranial nerve number 11. And we're going to have you shrug your shoulders. And then with resistance. Okay, cranial nerve 11 is intact. Now we're going to assess your gait. So I'm going to have you walk heel to toe forward 5 or 6 steps. Okay, and then we'll go backwards. Okay, and now we're going to test your upper and lower cerebellar. So I'm going to have you do this, testing your upper cerebellar. And then we're going to take your heel and run it down your shin, which is testing your lower cerebellar. Okay. All right, so I can have you sit back down. And then you can actually lay down because we've done our heart and lung sounds. So now I'm going to get into assessing the abdomen. First, we're going to start off by inspecting. We will be looking for any bulges, bruising, abnormalities. The skin color is appropriate for the patient's ethnicity. Her umbilicus is midline. And yes, so that will be the completion of our inspection. Her abdomen is normal. This would be done on bare skin. So now we can go ahead and move into auscultation. So we'll start with the right lower, and we're going to listen for a minute in each quadrant. If bowel sounds are not heard, we would need to listen for 5 minutes in total, but my patient does have bowel sounds that are active. And then we're going to go ahead and percuss using light percussion. Tympany is heard. And then we're also going to do light palpation. Shakira, if you feel any pain or tenderness, let me know. I'm going to feel, feel, feel. My patient didn't experience any tenderness or pain, and that is a normal finding for the abdomen. All right, you can go ahead and sit up. And now we're going to be testing our lower extremities. Okay, so here we would be feeling for any edema, swelling, looking for any bruises or lesions. None are present in this patient. The skin color is appropriate for her ethnicity. And then let's go ahead and move into range of motion. So extend your legs for me and back down, and with resistance and back down. And then we're going to also do this on the feet. So can you flex and extend your feet for me? Okay, and now with resistance and then back down. Okay, my patient has a full range of motion and full muscle strength. And now we're going to be feeling for the posterior tibialis bilaterally. And that's going to be +2 bilaterally. And then the dorsalis pedis, that's going to be +2 bilaterally. Okay, and then we would assess for capillary refill on both sides, but my patient has nail polish on her toes, so we would not be able to properly assess the capillary refill. Okay, and now I would just check to see really quick if I missed anything. Okay, I think that is a completion of our physical assessment, and your doctor will be in shortly.
Thank you.
Thank you.